Hello, everyone, and thank you for joining us during our seminar series with the Oregon Institute of Occupational Health Sciences. And it is my pleasure today to introduce Dr. Katia Costa-Black. And I'm just going to share a little bit about Katia and her background. She's been now with our institute for several years. And I actually met Katia at a total worker health conference probably about, I don't know, 8 years ago. 2018. Okay, about, all right, 6 years ago. And we talked about her coming to Oregon. So we're thrilled that she did come to Oregon. And Katia oversees the total worker health education and training portfolio within our institute. And she's also one of the MPIs of the outreach core of the Oregon Healthy Workforce Center. And she's tasked with developing and promoting the Institute's strategic partnerships with academic health and healthcare institutions and government agencies and also nonprofit organizations and the private sector employers. She has a dual clinical and engineering degree. She has a PhD in industrial engineering and ergonomics, and she supplemented that with a professional diploma in applied transdisciplinary research. She has extensive cross-disciplinary experience in research translation and collaboration across many sectors and types of stakeholders. And her research and teaching activities have really focused primarily on risk assessment management and program implementation methods. Also, she focuses on interventions to prevent workplace injuries, illness, and optimize health and well-being of workers. And she's really been the face of total worker health in the community across the country, representing the Oregon Healthy Workforce Center. So it is my pleasure to introduce Dr. Costa-Black.
Thank you, Leslie.
Thank you, Katia.
So is everybody can hear me okay with the microphone? Yeah. And yeah, a correction. Actually, we met. I have it. I have. We met in 2016. Actually,
okay.
It was.
Right,
yeah, it's been longer than I thought. I miscalculated that. But yeah, it's a pleasure to be here. Thank you all for coming. It's always a topic of passion of mine to talk about this, but I must admit this presentation is going to be a very light touch because this topic is gigantic, and I'm going to try my best to really highlight some of the things that I came across in my career, in my profession, that I find there's a lot of myths, and we need to be able to better understand what these principles are to really apply them in the real world. And there is a lot of conversations going on with new technology that is really shaping how workplaces are now being designed and redesigned. And I think it's an opportunity to reflect on what is the implications for health and safety and well-being. And what I'm going to be really focused on today is bringing you my perspective, mainly as a practitioner. I will utilize information from the research that is latest research in human factor in ergonomics to highlight what are these aspects of people-centric design environments that really support health and safety and well-being. And I hope that I will succeed and leave you here today with really the messages around what means to apply these principles in a way that aligns with total worker health goals. And I want to begin kind of really speaking a little bit why I'm speaking about this subject, and just go back to say the application of human-centered design principle is not something new, and why we are talking about this now. So in my more than 20 years working as an ergonomist, I have observed that many times we are trying to put out the fires related to poor workplace design, and which have really great impacts to health, safety, and well-being, but also has a very big impact on business performance. And one of the main challenges in ergonomics design is to really truly bring the attention and focus to the whole worker. And this is pretty much what I'm going to share with you is this kind of a guide through the lenses of a human factors and ergonomist professional on how we see the whole worker. And that is really what is really going to be the core of this presentation. But I also will provide you some of the examples around the application with these principles and illustrate how this can be done in different types of work settings. So it always starts here, and I have to acknowledge the multidisciplinary and even interdisciplinary nature of what we do in ergonomics. And there is a lot of information out there on how we really use this idea, and the central word for us in ergonomics is always the word interaction. So we talk about interactions in a very deeper way. But what we really want to talk on today is this, starting with the definition of what it means human-centered design, is really this approach to problem solving and innovation, and prioritize the needs, behaviors, and experience of people in the design process. It has become a foundational methodology across various industries and guiding the creation of products, services, and systems. And in the early 20th centuries, cognitive psychology began to shape the field of HCD. And what I would say is that it brought a lot of understanding from cognitive psychology on what it means, the mental work processes and the mental processes of users. And these perspectives really shift the focus from designing the products really and machines and equipment based solely on aesthetics and the technical capabilities of what things can do, technology can do, but consider more that human-centered perspective and looking to the users and how the users interact and respond to the technology and the use of technology. And then during this, in this evolution of the concept, during the World War II, the field of human factors engineering, and it's really now known as human factors ergonomics, emerged as a really important discipline to really integrate these different perspectives that was out there. And the focus of HFE was really in terms of improving the interaction between humans and the machines. And this particular moment of that evolution of the concept really brought the idea of designing for usability, for safety. Safety became a core aspect to look into it, and it's really remains as the core piece of what we do in human factors and ergonomics. It's safety. And so in addition to that, industrial design really emerged, bursting information with a lot of very well-known design. There was a movement in Germany called the Bauhaus movement. I don't know if you're very familiar with this, but this was a long time ago in the mid-20th century. And the idea was to bring simplicity to how human and machines and equipment are utilized. So how can we make sure that when we're designing new products, when designing new equipment, we are considering that idea of comfort and simplicity. And so that really puts everything kind of in the frame that I want to make to really illustrate that there are a lot of information out there on these concepts. And one idea that comes and stands out if you are looking to more specific understanding of what it means, the user-centered design aspect. And here I kind of want to just, for clarification, differentiate this terminology, because there's a lot of confusion out there on what it means, human-centered design and user-centered design, and is there a difference? And so just to really give you a differentiation, mainly when we are talking about user-centered design, and you have the UX professionals and specialists that are doing that work, their focus is really using the users as a tester. And so this is quite different than using the human-centered design and human factor ergonomics design that are really kind of interrelated, but it really, this whole perspective of the whole human and how all humans are users of equipment, of a technology, and how we can understand the users as a whole. And so this broader perspective really, this human-centered design takes really a broader perspective and consider also the full range of human experiences, emotions, psychological factors, and when we design anything. And when we use the label human, we're really characterizing a population level approach to look into that. So in the practical application of human-centered design, we have looked into standardize the process and standardize the way organizations can uptake that information and apply in the real world. So in 1990, I think in the beginning of the 1990s, 91, the International Organization for Standardization introduced a standard called the Human-Centered Design, the ISO 92-41-210. And for this particular one, it defines human-centered design as an approach that enhances the effectiveness and efficiency of systems, and I will explain that better, because it can be a lot of confusion of what it means systems, to improves human well-being, user satisfaction, accessibility, and sustainability, and counter-interacts possible adverse effects of use on human health, safety, and performance. So it's a lot to unpack on this definition, but what I want to highlight here is that this standard really help formalize the field of human-centered design practices and provide this really, really nice framework that organizations can rely on to follow this kind of guidelines. It's a voluntary standard. It's not mandatory in any country, but it just gives us this really practical way of embracing this approach. I don't know what happened. I didn't do anything. I just was scrolling down. Is it? Do I do anything?
I am no expert.
Whoa.
Maybe hit the back button.
Display settings. No. Maybe I should exit and start again.
No, yeah. And then just go back to
Okay.
presentation.
Okay. So, sorry for the interruption. So, the main core aspects of this definition that I want to unpack here is this idea of the interactions of systems. So, in ergonomics and HFE, when we refer to systems, we're talking about the human factors as the really centerpiece of that system, and then the elements of the systems that are related to the human, that interacts with human, are all going to be part of our unit of analysis. So when we talk about that, we can refer to the relationship between a man or a woman utilizing a tool, but we can go very big and macro and look into the relationships of people in the organization and how that is represented in the entire spectrum of what we call the social technical systems. So in a simplified way, what we're trying to do is really utilize our methodology, our technical and validated methods that are really being for over the years accumulated. And I'm going to share with you some of these methods that really are going to kind of really put a picture on what do I mean by analyzing these systems. And in aspects of the systems that I want to also highlight it here is that all elements of the system really matter. There's no one single part that is really not relevant for us. So system thinking is part of our training in ergonomics, and when we do assessments, we are considering that point of interaction as a way of addressing problems that we see that is affecting the system. So when we say a problem, we say system deficiencies, we say human error, we say accidents, we say all the kind of problems that we can observe by really seeing how people are interact with that system. And we consider the design of the task, the processes, the tools, and how people and groups of people are organized. And so there are a lot of ways of application of human-centered design. And I want to highlight this particular one that I think it goes hand in hand with the total health goals. And I will be able to give you some information about this, but this is just really to present it to you an example of a real way of collaborating and integrating the application of human center and really focus. The WELL, have anybody here heard about the WELL certification? Nobody? Wow, that's good. So I'm glad that I'm here. So WELL is being available as a standard and as a certification rating system that you can use, and for any organizations who wants to demonstrate how they are protecting human health, well-being, and performance with evidence-based parameters for the physical and social environment. A big characteristics of the WELL system for rating is this 10 criteria that over there, the 10 categories that they evaluate companies on, organizations on. The companies that want to meet these criteria, they're really going above and beyond anything related to regulations. They are really looking to the environment. And I want to pause here and give you a little bit of reflection on this. This is a global phenomenon, and we know that putting people first is really an important aspect of organization success, is achieving better business goals with that. And so this certification gives that reputation that organization needs to really prove that they are looking across many aspects of especially when it comes to the space and the place where people work, and we are speaking more specifically on the building environment. And so I'm going to describe a little bit more on the building environment, but this is really a unique kind of initiative, and there was many people putting together. There are a lot of designers and engineers that are involved in this. There are sociologists involved in this, anthropologists involved in this initiative, and it's really a global initiative. And so one of the things that gives organizational information on is this rating systems that they can measure where they are and where they need to be. And so very similarly to what we can do in terms of achieving goals related to total health, this is really enhancing organizations' possibility to really apply policy programs and practices that really goes hand in hand with these types of categories that you see there, the air. And as you know, all these categories are direct influence on our well-being. And so it's considerations of the physical environment is an important aspect of well-being. We know that the space and place really matters for business goals. And so the more research that we see on that information on supporting why it matters, and there are more and more linked to this work, is the work about bringing nature to workplace and supporting that mental well-being as part of the connection that we have to how we carry on our tasks in our lives. So there's a lot of explanation, and that's what I said in the beginning of this talk, that I'm only going to do a light touch because there's a lot of more details that goes into every single relationship of the building environment, and especially in regards to the well-being. So when we see the application of human-centered design in general, we see a very clear win-win situation. And there are examples that are coming from multinational, but it is also an example coming from very small business, that this is really a win-win situation. And we have proven the benefits both for employers and workers. And I only list a few examples there. But definitely, when we consider the human factors and the application of these design principles, and that I'm going to share in a second, we are really offering an opportunity for business to look across their performance and see what things can be improved beyond the individual level improvements that you would see with achieving efficiency in design. So design that are good for people will require also understanding who are these people, what they need, and what are their experiences, and what their interests are. So I'm going to go a little bit deeper into how to really look into the human aspects of design and how we can utilize and apply this design for enhancing, optimizing the work environment. One thing about keep in mind that I'm going to guide you through these guidelines. I'm not sure if you're all familiar with, but in 2021, the ILO and the International Ergonomics Association combined together principles related to decent work and how that really supports human at work. And one of the information that comes out from this report very strongly is the idea that organizations and employers need better guidance on how to really improve their work system to support workers and in a long term and to remain healthy and safe. So one of the quote that I really like from this report is this idea: without attention to human factors, ergonomics, work systems will not support the sustainability of workers, organizations, and societies. So this is really an opportunity to look at closely into how HFE has really provided that kind of a framework on better design and work environment to really address the needs of our society today. And so in this document, the value proposition of the human-centered design approach really focus on worker well-being, and it really provides the assistance to competent authorities like governments, decision makers in companies, employers, and even union groups to really look into closely at this idea about what it means worker well-being. And it really is applicable to all sectors, so all industry sectors, all occupations, and underlines really what I said before, the decent work. So if you haven't had a chance to see, I highly recommend. But I took from this guidelines a very important aspects that I want to discuss here. So some of the principles here, you can read it in yourself. I'm not going to talk about each one of them, but I'm going to be focused on one particular principle, and I'm going to be describing how that really, really interrelated to the total health goals. And so in these 5 principles that you see over there, you can see there are some words there related to keeping health and well-being and safety and well-being as top priority. You have the principle number 2 that is really about continuous evaluation and learning to really, really boost the metrics that is needed for organizations to succeed in that approach. And the principle 3 is really about providing and understanding information that really is a holistic perspective of what it means to create a safe and healthy environment. And the principle 4 is the one that I'm going to be focused on, and it really is about accounts for individual differences and organizational contingencies in the design of work systems. So this is really my focus of the next few minutes. And the 5 principles brings the transdisciplinary knowledge and the idea of worker involvement as part of the process of thinking on design. And one of the things, and just to highlight that principle,
And one of the things about the principle is that they are really the fundamental requisites to really support human factor ergonomic design. Without these principles, we pretty much don't have a full board scale of doing the sustainability piece that is proposed. So the application across different sectors is really clear when you read the guidelines and how you do that. You can really find information on how you can really utilize characteristics of population in a way that is unique for each environment. And I'm going to go over some of these details now. So how to account for individual differences. Each discipline, each background that you might have it here, you might be thinking about what it means, these individual differences. From our perspective in a human-centered approach, we are really putting the worker at the center of our process in how we do things. And so these are kind of really in a nutshell, some questions that are related to how we do and how we evaluate that interaction systems that I talked about in the beginning. Who are the people, what they do, and how people do it, and where people do it. So we always keep with those questions as our core way of moving forward, of making improvements on systems and system deficiencies. And just to bring it back to a comment that I made earlier, that exactly this idea of problem solving is one of the things that we do, but we also do proactive type of approach where we are utilizing the information and knowledge built from existing systems that are successful, and we learn from failure the same way we learn from success. And so we build on information from things that had not going well, and also we build information with things that are doing well. And this is how we're doing our data collection in a very simplified way. And so when we design for all relevant characteristics of workers, we have the consideration of to whom we're designing this for, and we consider the specific characteristics in terms of physical and cognitive capabilities and limitations. And then we design systems that really aim to accommodate a wide range of workers and the physical sizes and individual difference. So it is how we kind of really do the design application, and demographics of the workers really is an important consideration, because for any types of organization that are dealing with a transitional workforce that comes in, and we have now experienced challenges in the work environment because of the change of workforce demographics and how that is going to impact how we're going to optimize work systems and workplace systems and design. So that is really part of our starting point of thinking through to who we're designing this for. And as worker and global changes are happening, we are all embracing this idea of diverse workforce, and how can we really make sure that we take into consideration age, social background, expectations, gender, diversity, and all that. And this really makes a differentiation to making the system optimal. If the system doesn't take into consideration those different individuals, the system will not be successful. So I bring you back to think about something I mentioned in the beginning, which is the idea that everything we think is about house systems, and all elements within a design should be considered a part of this whole interconnected role, where each part affects each other piece and affects the overall performance. So think about creativity, innovation in the workplace. Think about the importance of keeping people not only in terms of supporting them in addressing what they need, but addressing the needs of their communities as well. So this is really kind of very holistic approach. And that's why the system thinking really helps us to really utilize methodologies that goes hand in hand with this idea that the people is at the center of what we do. And so people, so we pay attention to the micro interactions, not only the macro interactions, because we want to pay attention to behaviors and attention to patterns and difficulties that people might have on when they are interacting with systems. And just to say, I just list some of the design guidelines that exist for us. So we have, and I'm going to mention some of them. So we have designs, guidelines that goes for anthropometrics. We have design guidelines for cognitive support, design guidelines for psychosocial health. We have all of that as part of understanding the abilities of individuals. So across the spectrum of what we do in analysis of complex systems and system interactions, we have a variety of methods that are validated and all taking into consideration those human needs and capabilities that I mentioned before. And these methods really overlap between each other. They are not one exclusive to the other. So you see some of the categories there where you have a specific one that focuses on the physical, but it really it goes across the different types of methodology. And then you have all this kind of, I don't know the exact number, but we have something more than 300 types of methods available to use for these analyses. And so I'm not going to be able to give you all the applications of these methodologies, not the intention here, but I want to bring you back to say, well, we follow the idea of people first for designing principles, and how we do that is by better understanding certain aspects and characteristics of users and characteristics of workers. And so in that way, we utilize anthropometric data, which is really a large data bank that was created in the old times in the military. And then we transform this and using technology and much more sophisticated tools to do body scans and task simulation. We utilize this for a very number of ways. And now we can, instead of really, and this is in the practical world, this is very relevant because organizations really struggle to spend money on making changes in any operation, in any design, that really don't know the effects and the impact on the human and how it's going to be. So with the task simulators and the virtual reality environments, we are able to utilize a lot more data information there that supports the modification of a process or design of a workstation.
So these were originally, I mean, this approach was originally developed men. And how, can you speak to how it was really
Yes.
and changed, hopefully? I mean, I know it has over time, but not enough to really consider.
I'm going to repeat the question just because maybe people didn't say. So the question was that if this application of anthropometric has consideration for the gender differences, men and women, different sizes, all that. Yeah, so thank you for the question. Definitely the consideration for women is part of this. The data is actually populational data, and unique to different regions, different countries. So the tallest man in Japan is that high, and the shortest person in Japan is that high. So they consider men and women. And in our design categories, we look into extreme of in the population, who is the tallest, who is the shortest, and we put it in there. Everything between shape, size, people, body shapes also are considering now with all the 3D scanning technology. So actually, if you ask an ergonomist, can I design this for this person? You use anthropometric data, and you can design for anyone. Clothing, products, machine, anything you can name it. We can do calculations, we can do clearance, we can do reaching distance to make sure that accommodates.
Updated everything.
Yeah, yeah. Well, the data is updated.
The products.
Oh, the products. Oh, yeah. We're far away. Oh, yes. That's why I'm here, to talk about it. We need to use it. The data is there, so we need to use this data. That's definitely, there's a lot more about that I could be talking about and love talking about, but let's move on. So for the cognitive capabilities, we use a lot of ergonomics methods that are being developed. I don't know if you ever heard about the NASA task analysis. Anybody heard about that? So it's a cognitive assessment that does work analysis of the cognitive mental demands of a task. And so I list a few of them, and I'm gonna specifically talk a little bit on the cognitive task analysis because it has a really direct application. But just in a broader way, human cognitive capabilities and limitations really is part of like our interacted analysis, and we don't really separate that much. Our system is kind of really putting all together. But the cognitive aspects we look into is perception, memory, reasoning, information processing, decision-making, and then we pay attention to what things can really impact psychological health, and as well as the ability to perform work tasks. So our methodology goes hand in hand with observing people performing their work. And so we use triangulational methods where we combine quantitative, qualitative, perception, all of that. And so that's how we really get in the field, in the work, and get the information that we need to really understand problems with the systems. And so there's a dilemma now, and a lot of the human factor ergonomic research is going towards, and a lot of, I think also the financial side is going towards this heavily change on our work environment in terms of use of technology. And what I see a lot of the research now, and I'll be happy to share with any of you who wants to know a bit more, some of the readings that I've been doing on a human adaptation to technology coming from our, we have a very excellent publication journal called the Ergonomics in Design that really goes deep, deep, deep into that idea of use of technology. And so there's also a need to pay attention to the artificial intelligence implication and how it's pushing the boundaries of health and safety and well-being. And so we see really that kind of utilization of this interaction system analysis to really understand what this impact it will be like. So I can say there is some optimal news, I would say good news and some not very good news, but we are trying to really keep informed of the rapid change that are happening and trying to inform as best as we can the employers and organizations that are going to be affected by this. So one way of looking to these new technology consideration adaptations of humans is using the cognitive task analysis that I mentioned before, just an example. And so when we look into what cognitive task analysis does, they look very specifically about humans and as direct users of that technology and the degree of control that they have over the technology. And the studies, what they do is they bring into different groups and make comparisons and different users and different learners. So in human factor ergonomics research, we don't do a lot of randomized control trials. We do a lot of lab research, and we do a really massive amount of case studies. And so, and our case studies can be very comprehensive because we use lab results as part of case studies as well in the application in the real industrial setting. And the success and problems of using technology is really highlighted by understanding incidents and problems and machine failure, human error, the problems with interaction, and sometimes that interaction of humans and machines is also related to the interactions of human in a social system between people working in a team environment. So this is really part of how we do the cognitive task analysis. And just to give you a kind of a broad idea, what kind of questions we are asking when we're doing that kind of research is how do users expect the technology to work? We focus a lot on the perceptions of users and how is information displayed. So the idea of information processing is part of it. How well stereotypical expectations are met, because when we look into how people are doing cognitive tasks that are demanding, we want to make sure there is an understanding of what kind of expectation, how complex is the interface, how much training. So all this goes into the details of the analysis to really pull together information that are relevant to optimize the systems. And so in a really summarized way, many of the methodology and application of human-centered design principles really goes into the really top of the hierarchy of controls and the parameters. It's really about creating a better system by really rearranging system, modifying system, redesigning systems, replacing what needs to be replaced. So the elimination, the substitution, and the engineering controls are really at the top of what we do in the real world. And they are most effective. And so, of course, there are many types of problems and system deficiency that we can only fix by really looking to the behavior and modifying the behavior of individuals, but that is really not a priority. And then we keep it into that engineering and aspects as best as we can. And so I want to bring it in. I'm almost like wrapping up and give you time for questions. And I brought this example of total local health implementation to really bring it in forward some of the ideas that I presented earlier. So the focus of human-centered principles, if we are considering the principle 4 of really human as the centerpiece, we are considering a lot of changes that are going to impact people in a way that it might be different. Groups of individuals that are young or groups of individuals are older. But I love this example because they had an issue, and the main issue that they want to address is to maintain and retain an aging workforce that is doing manual material handling activities. And with that idea of retention of the work, they really look into what are they going to be the solutions that workers themselves are telling us that they want, but it also supports health, safety, and well-being all combined. So I really like the multifaceted approach that it was taken by the LLB case, because they look into not just the physical aspects. If you think about this, they look into rotating tasks every couple hours. So this is really also not just related to the physical, it's also related to the cognitive aspect. They look into minimizing the exposure to the manual handling tasks. Also, they look into using robotics, of course, and vacuum and lifting or ergonomics changes that will support that preventing injuries, back injuries, or any kind of other injuries. They're looking to utilizing fitness program that it goes hand in hand with what they do in the work, and the workers themselves were happy to have that. So the acceptance was also part of the evaluation of how they proposed this. And then they look into stretch and exercise programs. So it's a really robust, and you see the effects and impact here. And this is just the results they present, but I would argue that the results that they actually encounter is increased morale, increased job satisfaction, really supporting that idea of saying we are meeting not just the business goals, but we are meeting employees' expectation about what the work should be looking like. And I think that is really the idea of people-centric intervention that really speaks a lot to me as an ergonomist. And this is really pretty much the message that I want to give it to you. This is a QR code for talking points that I wrote for the American Industrial Hygiene Association. It really looks into explaining a very simplified way for occupational health and safety professionals, but also for leaders to look into key points on the design and system design, how you can really utilize that, look into noise and light and all the other things that are important for total health. Any questions? So I thank you for your time, and that's it.
I appreciate the last example. But you must have other examples.
Oh, yeah.
Can you tell us a few great examples of what you're doing?
Yeah. So you want an example of total health, or you want an example of the human-centered design aspects? So human-centered design has been used for a long, long time, and there are aspects of the design, to me, that had a lot of focus on the physical aspects of the design that has not really paid attention to the cognitive and other ones. I like this example for that. But in our work in ergonomics, the field of patient care and safety handling is immense amount of work that we're doing improvements. And I'll give you an example about work organization, job rotation done for nurses, where they look into decreasing the amount of distance that they go into from one room to another. So we did a cognitive task analysis. I worked on this project in the past, and we start looking at mapping the distance between the rooms that the nurses have to go to optimize efficiency in how they are actually able to be present to do the patient handling. So we did that. In addition to that, we look into the nurses' needs of having a separate room and a space where they can take breaks. So a combination of doing, optimizing the rotation and setup of attending patients with combination of giving them a room and a break where they can really rest and pause in between. So looking to the design space, the space and the place where the nurses were doing the work was kind of initial, but then we look into the needs that, and then how they're expecting the work and the task to be performed. And so there are tons of examples in healthcare, tons of examples in construction. I worked in a company where they were trying to implement a robotic system, and that robotic system really requires to be in the time that will optimize the braking layer type of work that they need to do. And so once that was done, there was concerns about how workers themselves will be operating in that location because of robotic safety. So we did a whole conversation, and we found out that the workers really utilized the time that was doing bricklayering that the robots were doing to do actually stretch and program and exercise program, because they didn't need to do that bricklayering work that robotics were doing. So there's all kinds of examples. I think these are the ones that comes out of my mind because it really calls my attention. But in the practical world, we see the creation of these ways of a better system with the workers' input really happening. And I have example in manufacturing and many, yeah.
So the focus on individuals that you've honed in on, has there been much work around neurodiverse individuals? And I guess I had another question which is how AI kind of touch on it. AI fits in, and I'm wondering if there's two actually. You could tackle one about this.
Yeah, so the question was about addressing neurodiverse individuals with human-centered design principles. Yeah, the research on that is happening. I think in the practical world, it's not really yet to be seen. I think in terms of designing better computer system, software system for neurodiverse individuals, it's really happening. And I think there's a lot of effort coming from the human factor ergonomics to really look into it. But in terms of all kinds of work environments, I think we're still far away to get there. But I encourage you to come to my presentation at GOSH conference, where I'm going to be talking about inclusive design and how that really applied to everybody, including neurodiverse and disabled individuals. So.
I have to ask a nasty question. Is OHSU doing any of this?
Oh, I'm not going to be able to answer that question.
Maybe everyone is. So like in the healthcare setting, can that model also look into how patients would feel better? You know, I mean, you want to have a patient feel comfortable in the healthcare setting too. So can that?
Yes, it is a very good question. Can the patient be part of the healthcare evaluation? And yes, so patient care is a very special area, and human factor ergonomics professionals that are specialized on this, they are really a special group that they really look into patient care very attentively. I would say that the publications I've seen are always consider patient needs and together with employee needs as one. But the reality is that many organizations are not yet really looking too deeply on that. But I would say an example that I came to mind when you were saying about patient care is the idea that with patient care, there's a lot of opportunities to really utilize these cognitive task analysis that I talked about, because we developed, there is one particular instrument that is being used that is actually integrate needs of patients in the process of analyzing the task. And so, so that's really part of our kind of assessment mode, I would say. The patient needs is not separate at all. I didn't mean to present it that it's just the people, but the people meaning everyone. And I think in manufacturing, even if you step outside the healthcare and you think about, there is also the consideration for customers and vendors and people that comes to the work environment, the needs of the people in the workplace. And I'm saying people, all people, it's what we are aiming for. Yeah.
One of the earlier slides with the Venn diagram of which worker was separated position.
This?
So the question that I have, I think I understand the point, but when you are de novo designing a workplace, that I see that this is a optimization, maintenance kind of formulation. But at the outset, it seems to me that the job task would have to be centered, because the skill sets, the workplace environment, the work organization, if you have a specific job and task, that would have to be at the center in order to be able to build the right environment. And so, do you think of this as rather than as an optimization way of thinking, or is it something that if, let's say, you had invented something or you have this idea and you want to invent and implement, that would the worker still be at the
core. Yeah, I'm going to try to repeat the question, but I don't know if I will succeed. But is the optimization of the task performance and the work environment done in a way that supports whoever comes next, right? It's not just the ones where you were evaluating and for. I think there's two parts of this that I call my attention. One is one opportunity, and thank you for your question, to mention the idea of prevention through design which is a very different way of thinking through utilizing these principles by using the designing out approach, where you are going to brainstorm with designers, with engineers, what are potential users, and not necessarily determine who the users are at that point, and then really create designs that are really for all people. Most of the time, we are actually a problem-solving approach where we're looking to, well, technology is being coming, and we have all this kind of equipment and machinery happening at the same time, and how can we make sure workers can operate safely, well, and well-being. And so we consider that the idea of demographics and the understanding capabilities of people are a very important component. So when organizations need very specific instruction into who is the workforce, how they can really, and the example of LLB is a typical one where you say, well, you know, you're going to optimize these tasks, but you're going to optimize the work environment as well. And it's for everybody, because not just the aging worker will benefit, right? And all the other workers too. So our main way of doing is focus a lot on the work population and the workforce, because in terms of the interaction, for us is the unit of analysis that matters the most. We don't deny the need of looking to, and we break down tasks in sub-elements, and we look into every movement, every aspects of the task with design of task. And here is kind of just illustrating that the whole interaction is what we are looking at. But in reality, we are observing and taking notes in each of these elements throughout our time. If a design is not done yet and we have to consider who is the person at the center, we look at population data. We really look into that.
Okay, we're going to go ahead and close down, but thank you
Thank
very
you.
much, Katia.